Hi, everyone, and welcome to your Nurse Voice Matters. My name's Wendy Trevarthen, your podcast host, and I'm very excited to have Dr. Sue Gledhill today. How are you, Sue?
Good, thank you, Wendy. It's lovely to catch up. We've met a couple of times over the years, I think. So
Yeah,
nice to catch up with you again.
beautiful. I was very excited when you said yes to come on to the podcast. So very happy to have you here. So I know you, but I don't think our listeners know who you are. So I'll just spend a minute or so going through your bio. So Dr. Sue Gledhill has a PhD, obviously, in an aspect of healthy aging, and we've just been talking to some about some of the activities that she's been doing. But she's also a registered nurse, a registered midwife, and an academic in the School of Nursing, Midwifery, and Paramedicine at the Australian Catholic University, Brisbane campus. Her qualifications include Senior Fellow of the Higher Education Academy, Graduate Certificate, Higher Education, MHA, Bachelor of Business, QUT, and she's also now semi-retired and continues to teach postgraduate units in the Master of Leadership and Management at Healthcare course at the Australian Catholic University. Her professional background includes health practitioner regulation, which is APRA, health policy analysis, Queensland Nursing Council, prostate cancer research, Queensland Cancer Council, dementia research centre, QUT, and nurse management, Prince Charles Hospital. That is certainly a wide and broad and very credentialed list. On a personal basis, she has 2 children, 5 grandchildren, a dog and a cat, and maintains a close relationship with all of them, particularly the dog and cat. I love that. Outside of her academic life, Sue has been a volunteer with the local community radio station 99.7 Bridge FM since 2017 as an announcer, co-hosting an arts and entertainment show on Sunday nights from 6 till 10. And from 2021 to 2025, Sue was on the board of the Morton Media Group, Inc., as secretary and continues to take an active management role. Sue also volunteers with the JPs in the community program. So, like I said, great to have you here to unpack a little bit about that career and your interest in the nursing profession and also the healthcare industry per se. So Sue, let's say you talked a little bit before we started today about, reminiscing with three of your nursing friends way back to the
Yes.
beginning. So perhaps if we
Yes.
could spend a few minutes back on your early training days, if you could perhaps give us
Sh-
2 or 3 highlights of what happened back then.
Sure. Or actually, I could go a little bit further back, Wendy, because you read out the list of my qualifications and credentials, but actually, I left home when I was 13, and to this day, I've never been back to high school. I've never had a high school education except for the first year. And the reason for that was I had a violent family background. My father was in the Second World War, and it was a war neurosis type of thing, and I ran away from home with a friend when I was 13. We hitchhiked all the way from Katoomba in the Blue Mountains to Sydney, and eventually I was put into a reform school, if you like. And when I was discharged from there, I was just short of I was 14 and 10 months, which was the age that you were able to get an early, you didn't have to go back to school.
Mm.
So consequently, I never went back to school. And so all of my qualifications that I have achieved over the years have been as a young adult, or I've never stopped learning, to be honest. Um, so how I got into nursing, I became an assistant nurse at the old at Eventide when it was the old Air Force huts. And yes, I'm still close friends with one of the girls that I started with in 1977. And I quite enjoyed the aged care sector at that time. And then somebody said to me, "You should go and do the EN course at Prince Charles." And I also, by that time, I was quite young, but I had two children. I was married by then. I got married young. And so I had two children, two young children, and I thought, oh, I don't know if I could do that. But we talked it over as a family and decided that we'd see how we went with my shift work that would entail. Anyway, long story short, I did the EN course at Prince Charles and I topped the class. And then somebody during that year that I was doing the EN course, somebody said, "Why don't you should become an RN?" And I think it was in the days when it was easier to get in to become an RN. I remember we had to do 2 3 hour examinations. And I got into the RN course at the Royal Brisbane Hospital, Royal Brisbane Women's Hospital. So that was how I actually got into nursing. And of course, nursing wasn't in the tertiary sector at that time. But once I'd finished, I had a taste for education and I wanted to go on. And because there wasn't a nursing degree available, I decided to enroll into the Bachelor of Business Health Administration at QIT. It was QIT in those days, the Queensland Institute of Technology. And so I was lucky enough to get accepted. I think because I had done pretty well during my nursing examinations, and yeah, so I was lucky enough to get into QIT, and I did a Bachelor of Business Health Admin over 6 years. By this time, I too was rising up through the ranks at Prince Charles Hospital. I went back to after I started as an EN at Prince Charles, and then after my training at the Royal, I went back to Prince Charles because I had a very strong affinity with that hospital. I loved the hospital. And so I went back there, and then as I embarked on the Bachelor of Business. So I finished that in 1991, and I think that was the year when tertiary education nursing became available. So, but by that time, I thought, well, I've got a Bachelor of uh, Health Administration, and also I'd become a 2IC and then a CNC, just become a CNC when I finished my degree. So I didn't see the need to do an actual nursing degree on top of that. And in fact, I wanted to do a master's degree by that time because I was really interested in the health admin, and I could see that I was probably going up the management pathway rather than into education or clinical nursing. So a couple of years later, my children were teenagers by then, and I enrolled into the Master of Health Administration. And someone said, "Oh, you shouldn't do, you should go to a different university," which is probably good advice. And so I enrolled in the Master of Health Administration in the University of New South Wales in Sydney. And because I grew up in Sydney, I loved going. I loved it. I just had a ball. I caught up with friends and relatives in Sydney while I was doing my masters because I only had to go down there for residentials. Of course, there was no online learning at that time either. You know, it was all distance. So I did my master's degree, and and at that time, I just sort of was. I was never going to stop learning after that. I just really enjoyed it, and then as I said, I was the clinical nurse consultant of a respiratory ward. And what happened then? I was I started the ward at Prince Charles at that time, and it maybe still is, was a mixture of young people with cystic fibrosis and a lot of older people who were often readmissions with chronic respiratory disease. And I started giving talks in the solarium at the end of the ward. That was in before it was rebuilt. And every Friday morning, I'd have these coping with chronic respiratory diseases or conditions. So there was a mixture of older people and the young people with cystic fibrosis. And somehow or other, the older people would say things like, "Oh, I'm no good to the missus anymore. I can't, I'm no good." And the younger people would say, "Why don't you leave your CPAP mask on if you want to have sex? Why don't you sit down? Why don't you sit up? You don't have to lie down." And these wonderful conversations. And fairly soon, I noticed that some of the older people were coming back in on the Friday morning after they'd been discharged just for those sessions. And I thought, there's a real need for older people to have an avenue to
Yeah.
discuss their sexual health. So while the session started out as coping with respiratory disease, they ended up being a large focus on managing sexuality with a chronic disease. And eventually, what happened after not too long, my talks got the physiotherapy department got wind of these people who were coming back in, and they would coincide they were coming back in for their outpatient physio, and they were trying to make my talks while they were after as the same day, the
Yeah.
same appointment time, similar, same day of appointment. Um, so the physiotherapy department came along and saw me and said, "What about putting your talks into the Better Breathing program?" And I said, "Sure, I'm happy to." So I had to, and so that they became more formalized then into the Better Breathing program. And eventually, though, I was looking for another job, or still in the hospital, but looking to do something different, because I'd been doing the CNC role for quite a few years by then. And so I applied and became a nurse manager. And the person who, my successor as a CNC in the respiratory ward, one of the first things she said to me was, "There's no way that I'll be talking about patients' sex lives with patients." And I thought, what a shame, and how typical. And this is the whole problem. There was no avenues for older people. Anyway, so those talks fell by the wayside. But also somebody said to me at the same time, "Why don't you go and see Jenny Abbey?" Now, Jenny Abbey was the first professor of aging in Queensland. And I went to see Jenny, not knowing, and I said, "Well, why would I go and see her?" "Just talk about what you've been doing and everything." So one minute I was talking to Jenny Abbey, and the next thing I was in front of Mary, can't think of her name, at QT. And I was enrolled in the PhD program at QT.
One conversation, that's all it takes.
That was all it took. Yeah, so I did. So the focus of my PhD was on aging and sexuality, and it was. And halfway through my PhD, I did that over 6 years. My children were well and truly growing up by then, and grandchildren were starting to come along. And but I said to Jenny, "I don't care if I don't get the PhD. I'm just really enjoying the research." And Jenny said, "Oh, no, no, don't say that." But the other thing was, a lot of people said to me, "Older people won't talk to you about sex. They don't talk to anybody." And I said, "You want to bet? I've had to close my books. I had too many. I ended up interviewing 36 people, but I couldn't write up that many. It was a phenomenological study. So I wrote up 16 interviews and went into depth about those. But yeah, there was a lot of people once they heard about my research, they
Yes.
wanted to be involved. And even a gentleman from South Australia rang me up, and he was one of my participants, even though he was in South Australia. And we kept in touch for donkey's years until he was 95, actually. So it was a very rewarding research. But coming back to where I started from as a 13-year-old girl, turning 14 from a reform school with no qualifications and no means of, and then having young children fairly soon, still in my teens. And I think what happened though was I had around that time when I was a teenager, I started to have a dream, and I could see myself in a white uniform, a white nurse's uniform. And I thought it was just something that was beyond my wildest dreams. There was no way. I had no education. I had two young children. I had no way that I thought of getting into nursing. And then all of a sudden, there I was, and over the years accumulating all these different qualifications. And I would have to say, having that vision in your head of what you want to do was really the deal maker for me. I don't know how. I often say to people, I don't know how I got into nursing. It wasn't like it was something I wanted to do as a child. It was just something. And then I had this vision, and all of a sudden, it's like, um, Moses and the tide, all the rivers opened up, and I just kept going along that bedrock of a river, and just studying and learning. And, that's how it all happened. And I have to say, nursing has been a wonderful career. I would recommend it to anybody. I
Yes.
really would.
Yes. When I spoke to you a few weeks ago on the phone and you mentioned all of this, the development that you've self-achieved over the years from a non-school pretty much background. You didn't do the higher education. And I mean, that just inspires me for all the nurses out there that feel that they've just, got the base grade to just get into nursing, that if so long as the passion and the connection is there with the purpose that you want to do and help people, that actually drives you forward to your career aspirations, definitely. And a really good anchor, to have that is aspiration all the way along and to really stay focused on moving that forward. What a wonderful story. Like, I knew you were connected with Prince Charles, but I didn't realize you were that connected with Prince Charles. It's
Yes.
isn't it? Built on a hill and sort of, mishmashed all together.
Yeah, and it was funny because I've kept in touch. My nursing group from the Royal, we were 81 to 85 years. That's when we trained, 1981 to 84, and we've kind of kept in touch. We've had reunions semi-regularly, like 5, 10 years over the years, and then one of my group said to me, or not said to me, but she posted. We've got a message group now. She posted, "I live in." I'm moving down from Gympie to Sandgate. Does anyone know of a walking group? And I'm in a walking group at Sandgate. So, of course, she's now in the walking group. And I never realised, she said to me, I got into nursing because I was a student nurse on your ward. And you inspired me. And I never knew that. All the years we trained together, because, when you're in a training group, you don't always meet your group until you're actually in classes. And I never realized that she acknowledged that I'd inspired her. And I thought, wow, that's just so, so wonderful, that for that to have happened, just for someone to do nursing because of an action that I might have done or, something I said. But so it was really, really heartwarming for me to hear that and to know that. So, yeah. And now my granddaughter is a registered nurse.
Oh,
So,
that's
so at least one of the 5 grandchildren have followed me in my footsteps. So that's nice too. Yeah.
What happened with your PhD study? Did you turn that into something after it was completed?
Oh, yes. I always said, because I've always been busy, because I've always been studying, I always said, when I retire, I'm going to write a book about my PhD because it was so interesting that to do. By the time I finished or I semi-retired at the end of 2021, podcasts were around, and I thought, oh, no, I'm not going to write a book. I'll just do a podcast series. And by that time, I was involved in the local community radio station as well. So I did the podcast series with a couple of other announcers who chatted with me. And we based each of those podcast stories on my research. I contacted QT to make sure that was all right from an ethical perspective, and that was fine. And I even contacted, Jenny as well. Jenny, I'm still in touch with Jenny Abbey. She's well and truly retired now in South Australia. She lives, and Robert Schweitzer was one of my other principal, and he's still at QT. And I just asked him, about the ethics of doing a podcast based on the actual interviews, and of course they're all pseudonyms, so none of them are recognisable. And some of the stories, I think we changed a little bit for the chat on the podcast. So it became a podcast series, which has just recently been taken down from the radio station website. And it's probably still available on Buzzsprout, a few other platforms there. But I'm on the point of developing another podcast series, but more focused on health and different health topics that relate to aging. So, yeah. So it's been a very rewarding experience all along the journey.
Yeah, nice. So if you were to give some advice, I mean, you've already mentioned, that nursing is a wonderful career for a young male or female. The male numbers are on the rise within nursing. What would be one piece of advice that you'd like to give to any of our younger nurses or the nurses that are sort of within the first 5 to 10 years of their career? And I know, like I wrote my third book about transitions, I know that there are nurses out there. Some of the nurses are in a position and they're thriving. They're really enjoying where they're working. They're getting a lot of satisfaction out of what they do. On the transverse, there is a lot of nurses that are quite frustrated. What would be your wise words about that?
Mm. It's a bit of a tricky one, but I think one of the things that comes back to your books is read, and read again, read more, read as much as you can about topics, the health related conditions, chronic conditions. I think being a reader has helped me all through the years. And I'm still a very avid reader. But the other thing I think is that vision that I had, if you want to achieve something, put it into your head in a picture. Picture yourself doing that or being that. And I think if you have a vision in your head, if you create that vision, anything is possible. Really, it is. I mean, when I think about where I started from, with against all the odds, with no foreseeable means of even becoming a nurse, let alone anything else. It was just, I think that vision really is what opened that river bank, the river up for me, just having that to go to keep moving forward. And it could be little steps or it could be big steps.
Yeah.
But eventually you will get there and it will be worth it, really will.
I
Yeah.
think too, like my fourth book is going to be around mentoring, and I'm going to write it in a different way than what I have done with the other ones. But I think having really good mentors around you, that obviously you were introduced to a lot of people that helped your pathway and even probably gave you a bit of a nudge in the right direction. I think that's one of the pivotal things that I've found too, is having those doors open for you and the opportunities, because other people can see the talent in you to be able to step forward and go into that area. Having really good mentors is essential to select the right path.
I think I definitely agree. I remember when I was the EN at Prince Charles, and it was like about 3/4 of the way through. And I remember it was a charge nurse in those days. The charge nurse said, "You should become an RN." And I thought, oh, I don't know if I could do 3 years with a shift work. And in those days, there was no flexibility. You
No,
had to do night shift when the hospital said. You had to do 6 weeks of night shift at a time. You had to take holidays when it was, rostered. So there was no flexibility. But I think it was that push. I wouldn't have thought of it on my own. And it was, that charge nurse at that time. I did see her as a mentor through the years. Jenny Abbey obviously was a strong mentor for me. And now I'm mentoring somebody to become a fellow with the UK Academy Higher Education. And so I'm now in that a formal mentoring position with
yes.
an academic colleague. And it's just wonderful. I'm delighted to be mentoring somebody through that process.
Well, they're very
So
lucky to have you, I'm sure. I'm sure you've got a lot of wisdom to impart onto their career, and also, help them blossom the way that they want to move with their career going forward. I think that's wonderful.
I
Yes.
hope so.
So, is there anything that you'd like our audience to know about? Something that you would like to bring their attention to, or perhaps how they
Oh,
would reach out to you if they had any questions?
yes, well, my email address is sue.gledhill@ACU. I'm still teaching at ACU. As Wendy said, I'm semi-retired, so I work entirely from home now, which is just wonderful. I love it. I think it's one of the few things we have COVID to thank for, really. That ability to become very quickly move into an online environment. So yes, you can contact me through my acu.edu.au email address. And of course, if you're not doing anything on a Sunday night, I'm on air from 6 to 10 p.m. on 99.7 Bridge FM. It's an arts and entertainment show, so nothing to do with academia. But yes, listen in if you if you want a little bit of light entertainment as well. So and we've met so many people
Yeah,
over the years,
yeah,
with
yeah.
through the show. And I guess I would say, get if you have a little bit of time, get involved in volunteering.
Mm,
It's another rewarding aspect of your life, and you do want that broad base. You can't just focus on, your studies. You do need something else. So, broaden your life, I would say. Create a vision, head towards it, and do a few other interesting things on the side.
yeah, nice. So there's a few high schools around that the students are doing, their community service kind of subjects. So there's a lot of opportunities for volunteering. I actually came on your radio station like 3 years ago, so I know it's a really good listen on a Sunday night, and you play really great music.
Yes, it's the music. It
Yeah,
was the music that got us into it in the first place. We just love that music. So,
yeah,
yeah. So, and lovely people. People that volunteer are generally nice people and, interesting to talk to as well. So we've got a great community, a little community within the radio station as well.
lovely.
Um, yeah.
Well, it's been a pleasure having you for the last half an hour, Sue. Thank you for sharing your career with us and the community at large, and really appreciate you spending that time with us.
Thanks, Wendy. It was a pleasure.
More than welcome. So you've been listening to Your Nurse Voice Matters. My name's Wendy Trevarthen. If you know a nurse that has a story to tell, feel free to put my name in front of them, and they may too become a guest on my podcast. Have a great day, evening, everyone, and we'll see you next time.